My name is Kak-Chen Chan. I'm the Chief of Pediatric Cardiology at DiMaggio Children's Hospital. A congenital heart defect is an abnormality of the heart that was either not well formed during its early formative stages in utero or before the baby was born. It's usually either a hole within the heart, missing chambers or missing blood vessels, or when the chambers or the blood vessels are on the small side. So there are various combinations. There's no hard and fast rule that is just a hole in the heart. And fortunately today, with the new technologies with diagnosis and surgical treatment, most of the patients would do very well with good outcome. Congenital heart defect alters the way the heart functions, and it alters what we call the hemodynamics, the blood flow to the body and the lungs. And because of the congenital heart defects and the alteration in the way the heart functions, their growth and development are affected. And we can see that very clearly in patients with serious heart defect. The question of treating congenital heart disease without surgery comes in two forms. My personal expertise is interventional cardiac catheterization. That means my role would be to go inside the heart by cardiac catheter technique and close holes in the heart or treat obstructed valves. Now that would be a non-surgical form of treatment of structural heart anomaly. But the other form, where the congenital heart is already perhaps treated by us, but the heart function is not normal, then we would use medicine to stabilize and strengthen the heart function. So that would be the other form. I think the prevalence or incidence is always the same, except that it's now easier for us to make a diagnosis with the new techniques. And certainly when we look at young athletes who drop in the field, it's usually a genetic cause of the heart defect, and because they are born with it, it's congenital, but they are not structural to a sense. They are usually electrical instability of the heart. So when they run, the heart becomes very irritable and they develop tachycardia. Our program is unique in the sense that I would like to hark back to the days of the good old TV program, the A-Team. You are actually looking at the A-Team. We are a collection of very senior people in the field of pediatric cardiologists, and somehow or rather, by forward planning, were brought together by the Memorial System, DiMaggio Children's Hospital, and here we are. And we can provide all the treatment modalities as well as any other centers in North America or perhaps even the world.